Hello, my name is Gareth from Cardiff Pain and Performance Clinic, and I just want to run through today the 5-step treatment process that we use here at the clinic to try and get our patients who come in often in chronic pain or with unresolved pain and injuries back to 100%, doing the things they want to do and the things that they love. So the first thing that we do when people come into the clinic is really find out, are they in the right place? And what that means is figuring out, do they have a structural problem or something more what we would call functional? Now, what I mean by that is a structural problem would be if I had a shoulder pain and it turned out I had a true tear in one of the ligaments or tendons. For example, a structural problem would be a broken bone. There's an issue with the joint itself. A functional problem is much more one where compensation builds up over time and there's no damage to the tissues at all. So that's step one, are you in the right place? Step two, for those people in acute pain, is to use our red light laser therapy to reduce any inflammation that's local to that area. This is completely pain-free and non-invasive, and it's just a really nice way to help speed up the healing process if that needs to occur. The third step in our process is probably the main part, and that's to desensitize. Now, if you've watched any of our other videos, you'll recognize that we talk a lot about the brain and how pain is because of an overprotective nervous system, and it has less to do with the bit that hurts itself. If your brain detects more danger and less safety, you're more likely to feel pain. So using the methods we do here at the clinic, we're going to find areas of heightened sensitivity and help reduce that so that your brain feels safer about letting you move once again, as long as there's no damage to the area, of course. The fourth step in that process is then all about loading. Now, it's all well and good to have an area that's become desensitized, but can you move it? Do you understand how to move it? And does your brain recognize how to move that area? If for the last 6 months you've been struggling with shoulder pain and you've never lifted your arm overhead, we can't just expect you miraculously to then be able to do that pain-free. So we have to slowly load the area into these new places and get comfy with doing that. Which then takes us on to our final stage, which is all about strengthening. So now that we've got this newfound range of motion, we understand how to move the area in relation to the other joints of our body, we're then going to start to strengthen that up to try to bulletproof it and stop these problems from coming back in the future. So hopefully that gives you a good snippet into our process here at the clinic. And if you have any concerns or questions, just let us know.